Tennis elbow. Tennis elbow is called lateral epicondylitis. Tennis elbow is an overuse injury that causes inflammation, tendinosis, and lateral elbow pain at the origin of a small muscle called the extensor carpi radialis brevis. This is the location of the pain on the outer side of the elbow. The pain may interfere with sleep and activities, or even carrying groceries. When this muscle is overloaded by repetitive activities, it causes pain in the outer side of the elbow. I'm going to go into some details about this condition. It is the most common cause of elbow pain. 50% of tennis players develop tennis elbow due to many technical reasons and risk factors such as incorrect grip size, poor swing technique. This condition also affects workers doing heavy lifting or repetitive gripping or using heavy tools. The pathology of the tendon shows disorganized collagen and angiofibroblastic hyperplasia. The condition usually starts by micro tears of the origin of the extensor carpi radialis brevis due to eccentric overload, which is precipitated and aggravated by repetitive wrist extension and forearm pronation. So the patient with tennis elbow will complain of pain with gripping, decreased grip strength, pain with repetitive wrist extension. Patient will have tenderness around the lateral elbow. Here is the pain of tennis elbow, and here is the pain for the radial tunnel syndrome. The radial tunnel syndrome should be in the differential diagnosis of tennis elbow, especially if the patient is not recovering as expected from tennis elbow treatment. You got to suspect the patient have a radial tunnel syndrome. The radial tunnel syndrome gives pain about 3-4 centimeters distal and anterior to the lateral epicondyle. Radial tunnel syndrome occurs in about 5% of the patients due to compression of the posterior interosseous nerve. Also, you need to rule out cervical disc and triceps tendinitis. Basically, the diagnosis of tennis elbow is based on the symptoms and physical examination. The provocative test, which will increase the pain at the lateral epicondyle, is resistant wrist extension with the elbow fully extended. You can get x-rays of the elbow, but the x-rays is basically normal, and rarely you may find some calcification. The treatment is usually activity modification, non-steroidal anti-inflammatory medication, physiotherapy, especially eccentric exercises. Injections are frequently used. Injection can be steroid injection or maybe PRP injection. The ultrasound guidance may be helpful in the injection. And bracing. There is 95% success rate with non-operative treatment to relieve the pain, which may take up till 6 to 12 months to improve the condition. Surgery is the last resort for release and debridement of the extensor carpi radialis brevis origin. Excessive debridement and release of the tendon can lead to injury of the lateral collateral ligament, and that may lead to posterolateral rotatory instability of the elbow. The extensor carpi radialis brevis muscle, the tennis elbow muscle. The name of this muscle suggests that it is a short muscle And this short muscle is involved in multiple important conditions. This muscle originates from the lateral epicondyle of the humerus. They call it the common extensor tendon. The extensor carpi radialis brevis is inserted into the base of the dorsal aspect of the third metacarpal. The extensor carpi radialis longus is inserted into the base of the second metacarpal bone. The ECRB is innervated from the radial nerve. The function of the extensor carpi radialis brevis muscle is to extend and abduct the hand at the wrist joint. The extensor carpi radialis brevis and longus is located in the second dorsal compartment on the radial side of the Lister's tubercle. There are several conditions that are associated with the extensor carpi radialis brevis muscle. Tennis elbow or lateral epicondylitis is an overuse injury that causes inflammation, tendinosis, and lateral elbow pain at the origin of the extensor carpi radialis brevis tendon. It is the most common cause of elbow symptoms in patients that complain of elbow pain. The condition usually starts by micro tears at the origin of the muscle, which is aggravated by repetitive wrist extension and forearm pronation. The patients usually have lateral-sided elbow pain and pain with resisted wrist extension, while the elbow is fully extended. 50% of all tennis players develop tennis elbow, usually due to poor swing technique or incorrect grip size. During the acceleration phase of tennis ground strokes, the greatest EMG activity is found in the extensor carpi radialis brevis muscle. In tennis elbow, the patient will complain of point tenderness with palpation around the lateral epicondyle in the area shown in this picture, but be aware that about 5% of patients may have an associated radial tunnel syndrome. In radial tunnel syndrome, the point of tenderness is about 3 to 4 centimeters distal and anterior to the lateral epicondyle. The radial tunnel syndrome should be in the differential diagnosis of tennis elbow. To diagnose the radial tunnel syndrome, you want to inject the radial tunnel and see the result. Lateral epicondylitis is an overuse injury with angiodysplastic proliferation, which involves replacement of the tendon fibers with vascular granulation tissue and fibroblasts. The pathology of the affected tendon shows disorganized collagen, vascular hyperplasia, and fibroblast hypertrophy. Treatment of tennis elbow. Usually the treatment for tennis elbow is non-steroidal anti-inflammatory medication, ice, and activity modification. Physiotherapy. What is the therapy used? Tendon gliding exercises. Eccentric conditioning and the strengthening program is usually recommended. Physiotherapy usually results in more symptomatic relief at 1 year than steroid injection. Steroid injection up to 3 injections. Steroid injection may be useful to control the acute symptoms. Tennis elbow usually resolves with time, regardless of the conservative treatment method that is chosen. Up to 95% success rate with non-operative treatment. Surgery is the last resort. The extensor carpi radialis brevis muscle is also involved in the intersection syndrome. What is an intersection syndrome? It is an inflammation at the crossing of the first dorsal compartment and the second dorsal compartment that contains the extensor carpi radialis brevis. It occurs from repetitive wrist extension. The tenderness is on the dorsoradial aspect of the forearm, approximately 5 centimeters proximal to the wrist joint. This is the area of inflammation of the extensor carpi radialis longus and extensor carpi radialis brevis at the intersect with the abductor pollicis longus and the extensor pollicis brevis. So it is the area of the intersection of the second dorsal wrist compartment with the first dorsal wrist compartment. The extensor carpi radialis brevis muscle is important in dorsal approach to the radius. The Thompson dorsal approach to the proximal radius may be used for exposure of the posterior aspect of the proximal radial shaft. The incision is made between the two muscles of the extensor carpi radialis brevis and the extensor digitorum. Another condition where the extensor carpi radialis brevis is involved is iatrogenic posterolateral elbow instability. So during tennis elbow surgery, an excessive release of the extensor carpi radialis brevis tendon, which is the origin of the muscle, can cause injury to the neighboring ulnohumeral ligament, and that can cause posterolateral elbow instability. This occurs due to the proximity of the origin of the extensor carpi radialis brevis tendon to the ulnohumeral collateral ligament. The ligament is close to the tendon, and excessive release of the origin of the extensor carpi radialis brevis can cause injury to that ligament and subsequent posterolateral elbow instability. Another condition when the muscle is involved is tendon transfer in a high radial nerve palsy. In a high radial nerve palsy, injury to the radial nerve results in wrist drop due to paralysis of the extensor tendons. So the pronator teres is transferred to the extensor carpi radialis brevis to restore wrist extension in a high radial nerve palsy.